Performing a musculoskeletal examination virtually can be challenging, but not impossible. Since most of the examination is based on inspection, which requires the ability to visualize the patient, and palpation, which at best can be done indirectly by instructing the patient on what to do, such encounters are best done using a video call platform. If you have to perform a musculoskeletal exam during a phone encounter, you will rely heavily on the patient's history. In asynchronous encounters, you are able to assess the patient through still images. The information is still limited compared to the objective information you can obtain over a video call. First, you need to make sure you can view the area of concern. This may require the patient to change into a tank top or shorts. If you notice an inflamed joint, consider the possibility of septic arthritis, which requires immediate emergency care. Look for deformities, such as from dislocations or significant fractures, which also require immediate in-person care for treatment. Don't forget that the source of pain can be the joint distal or proximal to where the patient is feeling the pain, so these areas should be viewed as well. If there is an acute injury, make sure to check distally to confirm that the extremity is well perfused. Any evidence of cyanosis should prompt an immediate referral to the emergency room. An additional item to keep in mind when performing the initial inspection is muscle bulk, as atrophy indicates the presence of denervation or chronic disuse. For back or lower extremity complaints, make sure to watch the patient walk. This may require moving the patient's camera so you can view their whole body walking both towards and away from the camera. Don't forget about the different gaits, like heel or toe walking, to test for lower extremity strength. An inability to heel walk suggests the involvement of the L4 or L5 nerve root in the setting of back pain, while the inability to toe walk suggests involvement of the S1 nerve root. Next, ask the patient to move the joint in each possible direction and watch for decreased range of motion. This can be easier if you have the patient mirror your movement. To aid in strength testing, you can ask the patient to use the uninjured side to push against the injured side for resistance, but this can be unreliable. If the patient has someone with them, you can walk them through how to provide resistance. Another option is to have the patient use the wall and press against it for resistance. The patient can then say if the affected area feels weaker than usual or weaker compared to the other side. Make sure to have the patient differentiate true weakness from pain that limits them from pushing harder. Testing sensation can be difficult virtually, but not impossible. You can have the patient use a cotton ball or ice to test the area for numbness, especially if it can compare one side to the other. Depending on the area of concern, there are likely many different maneuvers you could ask the patient to self-perform by having them copy your motions, but this can be challenging. If you want to learn tips on how to perform specific virtual maneuvers, please check out the references in the course handbook, where I provided a few very helpful resources. Depending on your level of clinical concern, you may opt to order imaging for the patient directly through the virtual encounter, if that's an option for you. When considering whether or not to order imaging, I strongly recommend you keep in mind the same indications and standards that you followed during an in-person encounter. For instance, for patients with acute low back pain, no red flags, and no significant neurologic deficits, imaging is not indicated. It is better practice to refer the patient to in-person care. Likewise, if you have enough information to know you would order imaging, don't let waiting for an in-person examination delay ordering imaging. In many cases, the situation is not serious and likely to self-resolve with conservative treatment. Of course, if symptoms do not resolve or worsen, the patient can always be reevaluated and, if needed, referred to in-person care.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Med Mastery can help you become a great clinician, make sure to watch the About Med Mastery video. So thanks for watching, and I hope to see you again soon.